Hello everyone, I'm Dhanya Rajendran from the News Minute. Joining us today is Dr. Meenakshisundaram from the SIMS Hospital in Chennai. We are going to be having a very important conversation. In fact, many of you have sent me questions of what you want the doctor to answer. Uh, we'll directly get on to the topic, doctor. The first question for you, since this whole discussion is going to be on stress and stroke, and we have named it Stress and Stroke, Be Calm, Be Healthy. Dr. Meenakshi Sundaram, the first question to you is the basics. What is a stroke and what does it do to your body?
Okay, stroke by definition would be a problem in the brain caused by any abnormality in the blood supply to the brain. Now, when you say abnormality in the blood supply, it can be a disruption of the blood flow, meaning that it can get blocked, or you can have bleeding into the brain. So basically, there are two types of stroke. It's like in simpler terms, if the blood flow to the heart is stopped, everyone knows a heart attack called myocardial infarction and heart attack. It's when the blood flow to the heart is affected. When the blood flow to the brain is affected, it's called a brain attack or a stroke. And only difference is that here there's an additional element that there can also be a bleed that can happen in the brain, which again is called a stroke. So there are two types of stroke. If five people have a stroke, four of them are likely to have had an ischemic stroke, where there is a block in the blood supply to the brain, while one is likely to have had a bleeding into the brain. So that's what stroke is about.
So, what is the difference between a stroke, a cardiac arrest, and a heart attack? I know these are very basics, but many times people don't realize what the difference is. And for those who are watching in, Dr. Meenakshi Sundaram will also answer your questions. So, if you have any questions, type it on the comment box. Doctor.
Okay, no, it's a very important question. We are asked this question almost on a daily basis. So it's like I've been answering this question for 25 years. So it's very important to know a cardiac arrest, as the word says, is the heart goes into an arrest. The heart is a rhythmically pumping organ. You think about your motor at home that's just pumping, it just switches off. That's a cardiac arrest. Now, what is a myocardial infarction or a heart attack is what I said, that there is a block in the blood supply to some part of the heart, then it's called a heart attack. So that's what the scientific terminology is myocardial infarction. But a stroke is to do with the brain. It doesn't have to do with the heart. It has to do with the brain. A disruption, which can be a block or a bleeding into the brain, then producing a deficit in the person who is affected, then it's called a stroke.
So my next question to you is how severe can a stroke get and what does it do to your body?
Okay, see, let's understand the brain first. The brain, the common example that I would use to my patients or to my students is that the brain is like the main board in your house. How important is the main board to your house, and if it's not there, no electrical work, nothing is going to happen in the house. And I'm not talking about the mechanical moving parts, we're talking about electricity per se. Now the bulb, the tube lights won't work, or the fans won't work, the fridge won't work, the TV won't work, nothing will work. So it depends on, but you can have some times when you can have one phase. If there's a three-phase supply and one phase goes off, then you can have only particular things affected. So the brain is like the master switch or the main board, where you have representations for everything. Now, if we are speaking, I'm moving my hand, I'm looking at the screen, I look at a particular place, I hear what you say, I sense through my ears, through my skin, through everything. Everything has to be done by the brain ultimately. So there are areas for everything. So you can have a specific area, like there can be a problem in the brain, stroke, as I said, a disruption of the blood supply can occur in one small area, and that one small area can produce only a problem with vision, or a problem with speech, or just a numbness, or just a little weakness of your thumb or your hand alone, or it can be a major one where one side of the body doesn't work at all totally, or both sides don't work when it occurs in other more important areas. So the how severe it can be. Well, it can be very severe, and it depends on which artery. Artery is what carries the blood to the brain. Which artery is affected, and which part of the brain is affected.
So, both as a journalist and, of course, as a person living in Bengaluru city, I keep hearing family, friends, and even in the news, a lot of cases of stroke amongst young people. In fact, that's one of the questions that we've got also. Is it really true that there is more cases of stroke amongst young people, seemingly healthy, leading a healthy lifestyle? Or is that a myth or is that an exaggeration, would you say?
Well, we don't have right now maybe concrete numbers to say that there's been this percentage of increase, but I can definitely tell, anecdotally at least, that there has been an increase in the number of strokes that we see in young people. So, by young stroke, again, scientifically defining that is a stroke occurring in a person 40 years or younger. So we are seeing quite a few, and then we need to understand. We're looking at why it's happening. That's a different thing. But to answer the question specifically as to what you asked, yes, we are seeing an increasing trend towards increase in incidence of stroke among the young people, and that has probably been contributed by the increase in the risk factors for the stroke.
So, just a personal question. The other day, I was forced to go for this full body checkup, and the doctor said that my bad cholesterol is quite high. So, there is a moderate to severe chances of stroke. Uh, is that just, I know that a lot of people are getting these warnings when their cholesterol levels are up. So, does it differ from person to person, or are there reasons why a person is more prone to getting stroke?
Right. So we need to understand the risk factors for a stroke. Now, practically, if you look at the ischemic component alone, where there is a block in the blood supply, it's very similar to a heart attack. The risk factor, well, the number one, the most important risk factor is age, which nobody can do anything about. So that's something that's not modifiable. So age is something that stroke occurs slightly more commonly in men, and it sort of equalizes between the genders postmenopausally in women. And the other risk factors would be habits, smoking, hypertension, diabetes, obesity, the sedentary work, and dyslipidemia. And that's what you're talking about. Dyslipidemia is a problem with your lipid profile, meaning that because we talk about good cholesterol, bad cholesterol. Now, what is the latest recommendation is to talk about HDL cholesterol, which is supposed to be the good cholesterol, and non-HDL cholesterol. Now, we need to understand that cholesterol is not something that should be hated. We need cholesterol for the integrity of the cell membranes and everything. But anything that is too much is not good. And then similarly, so a cholesterol that's high can impact the arteries, can produce problems, thickening in the blood vessels, affect the blood flow, and ultimately lead to a stroke, just like it can lead to a heart attack. So yes, so if we have a rise in non-HDL cholesterol, leave alone bad cholesterol, we used to call LDL the bad cholesterol, it is. But there are also the VLDL cholesterol and the other components. So non-HDL cholesterol is harmful, is one of the risk factors. It's not the only risk factor though. That's important to remember. It doesn't mean that if your cholesterol is normal, you can go about doing anything you want. You need to be careful about your habits. You need to be careful about exercising well. If you have diabetes, you need to keep it under control. A BP needs to be maintained properly. That's another word of caution too. Now, the cholesterol needs to be maintained appropriately at adequate levels. Too low a cholesterol is also not good for the brain. If the cholesterol is too low, can be a risk factor for the other types of stroke, which is bleeding into the brain. And supposed to be the reason why in Japanese the incidence of hemorrhages into the brain, bleeding into the brain, is said to be higher. Two reasons. One, the consumption of alcohol is supposedly higher in that population, and cholesterol levels are low. And this is a deadly combination. And if you have hypertension to add it, then the risk of bleeding into the brain is much higher. So you can still have stroke. You may not have an ischemic stroke, but you can still have a hemorrhagic stroke. So it's important to remember that cholesterol should be maintained at an appropriate level.
So you enumerated a lot of risk factors, which are also very generic, which is, when you get older, you're at more risk or different types of cholesterol levels. But what is it that people should watch out for? Now, that's what everyone's concerned about, right? What are the risk factors that you watch out for? Or what are the combinations of risk factors that you watch out for? It's a personal question also.
Right. See, this was very long ago. John Sterling Mayer, I think, said this in 1982 or 40, 50 years ago. The two highest risk factors, which are the highest thing for an ischemic stroke, are smoking and hypertension. That's what he said at that time. Now we know that diabetes also is equally important. So, what can you do? Well, you check regularly, especially if you are now, we can't even say if you're 40 plus, if you're 30 plus, then check regularly. Check regularly doesn't mean that you get obsessed with it. Check regularly, get your sugars tested on and off, your BP tested occasionally, and more importantly, exercise well. Do your exercises well, be active, keep your brain active, keep your body active, in a sound mind and a sound body. So it's very important to remember that what we read in school. So it's very important to remember that all through life. So it's very important that you don't do a sedentary. That I think is the problem now. The sedentary lifestyle is a major problem now. That includes us doctors. I sit in my clinic, I see 4 or 5 hours at a stretch. I keep seeing patients. I may forget to get up and walk. I may get up, see a patient, come back and sit. Of course, I have to sit down to write. So that ends up being a lot of sitting time. It's very important to take a break in between, maybe walk around, maybe do small exercises, stretch yourself, keep yourself active. I think that's something that everybody would remember. But for
But
cholesterol, let's say
is
since
this
yeah,
sedentary lifestyle very common now, especially because we work from home? Like I have a tendency to sit in one place. I have a colleague, Anna. She gets up every 30 minutes and she walks. And then she gives me this warning that I am not walking. So isn't this sedentary lifestyle very common now, especially after work from home?
yeah, you should listen to your colleague. She is right that you should get up and walk. Now, if you're sitting for half an hour, there's sitting is called the new smoking. If you're sitting for 2 hours continuously, it is almost like having 1 or 2 cigarettes. It's that risky. So sitting is actually called the new smoking, prolonged sitting especially. So better not. So if you're on a system, it's important that for the eyes, we say that it's a 20-20 formula. You've been looking at the system for 20 minutes, then take your eyes off, look at a distance of 20 feet for 20 seconds, then come back. That's for the eyes alone. You don't develop dry eyes and all that. That's a different thing. But for the heart and the brain especially, very important that you get up and walk around, move your muscles, don't be sedentary. Prolonged sitting is harmful and it has been substantiated by scientific evidence.
I think I'm going to hang a slogan. Sitting is the new smoking, just to
Please, please,
inspire me to stand up and then keep
please,
walking
please.
for some time. No, I really mean it. I sometimes forget that I've been sitting for a long while because I'm so into editing a copy or editing a video, and I forget to just stand up and walk. But sitting is the new smoking. Everybody, please remember. Uh, Doctor, another related question, and if you want to add something to the previous one also, how important is stress in all this? How important is stress a risk factor? Are there any studies which tell us that? And are you also seeing that a lot of patients who come to you lead very stressful lives, personal, professional, etc.?
Well, stress and stroke have mutually propagating uh, tendency. If you have stress, you would have a higher risk of stroke. If you have stroke, naturally you get into stress, and more stress is more risk of stroke. So it's a vicious cycle. So leaving that apart, stress is definitely a risk factor for stroke. Why is it so? Now, what would you do if you're stressed? If you're stressed, what would you do? Whenever you get stressed, you would lose sleep, your mind is preoccupied, you don't sleep well, brain doesn't rest well. Then what happens? Your BP goes up, you get into a depression, When you're stressed, cortisol levels hover higher up in your body, so your blood sugar will go up, your cholesterol levels can go up. That's you practically you had it. And then what would a guy who's stressed out do? Get up and he said, I'm too stressed out. That's a common reason. Get up to go out and have a drink and a smoke. Now you completed the cycle. The whole now the full house is there, as they would say, bingo. So now there is a full house. You have all the risk factors, and that's a secondary effect of a stress. Now there was this study. There was a study that was published last year in one of the most respected journals, and in that study they found that when you talk about stress, we'll not talk about domestic and home stress, and that's different. Talking about work-related stress, what are the factors that work-related stress can which influence that? Who is really affected by it, and who is at risk for a stroke? The 2 points that came out. One is how much of time oriented, you say give them timelines and say that by this time I want a report, by this time I want this done. That's one thing. The stress of timelines and everything, running after timelines, that's a stress. And the number two, whether they have control over what they are doing. Can they change anything at all? I think this applies to everyone. We can even think about our own employees and think if we're doing the right thing. So these are two things. What came out in the study? We'll go to the good aspect first. Two types of people. For example, the nature scientists, the architects. It's very easy. They don't have timelines many times. Architects may have, they're into a project and all that, but generally, they don't have this rush to finish things. And two, they have good control over the work. It's shown that these two people had lesser incidence of strokes. While who were at highest risk? Unfortunately, the people who were at highest risk were the waiters or waitresses at the restaurants or hotels. You can imagine. They are constantly stressed. You can dine and get out. The next person is already there and they have to rush for their orders, get it in time, other that guy gets angry. If he doesn't serve in time, he gets black marked. So he is always running after time, he or she. So, and they have no control over it. They can't change their work schedule. So it's very ideal situation. Similarly, nurse aides, the senior nurses apart, the nurse aides, again, they're always under control. If the patient bad there, go look here, go look there, go look here, is something that will keep running. And they have no control over that. They have to keep doing it. They can't change anything. These two people were found to be at highest risk. You know how high the risk was? 22% high risk of stroke. So how does stress cause stroke? Yes, it does. It definitely does increase the probability of a stroke. Very important to remember that. We all talk about stress, I'm too stressed, I'm too stressed, but make sure that don't use stress as an excuse. And I always say this when people come and say, Doctor, I have a stressful job. So I invariably say that, okay, you see, I have friends in quite a few industries. If you have a problem, if you think there is a job that is no stress, please tell me. I can probably try and get you a placement somewhere. So there is nothing called a stress in the job. It is something inside you, and if you have to recognize that first. It's me not adapting to my work style, and if I have the control over it, I can change the way I work. Like I can change the way I work. But if we don't have a control over it, so that how best do I enjoy my work? Like the Japanese proverb says, if you love what you do, you don't have to work even one day. It's like holiday every day. So it's important to know your stress levels, and if you know that you're hitting it there, hitting the roof there, need to take a break, need to get out, calm down, and come back and sit down. And that's where I think stress can be handled.
So one question we have got is that a lot of times people may not realize that they are stressed, work wise, or I mean, like you said, they've not adapted to their workplace or to their work, etc., or even in their personal lives, but they don't recognize the fact that they are stressed out. Is there any physical or tangible evidence by which one can understand that, see, my body or my mind is stressed out, I have to give it a break?
Yeah, if you're not sleeping well, I think that might be something that would easily get. If people tell that you're a light sleeper and you don't sleep well, these are important markers that you're probably getting stressed out. If you sleep immediately after hitting the bed, it's a marker that you're sleep deprived. It's not like you're a very calm person too. You're sleep deprived. So that's why the minute you hit the bed, you sleep. So there are markers for everything. If somebody, so what can we do? Well, we can scientifically we can do blood tests and all that, but I don't think it's a very practical thing to do. Don't ask people to go and do a blood test, look for this hormone to know whether you are stressed. Most often, it's something that people would come out and tell that I'm not okay. I just don't feel comfortable. I don't feel like going to work. Or the reverse, I don't feel like going home. I want to stay in the office. So the stress could be in either place. Most often, they recognize and come. Very uncommon that they don't recognize it.
I have one more question about stress, which is, do you remember any case recently or any time which you had where the person came with a stroke and you felt that stress was the main reason? There were no other risk factors. There were not too many other risk factors.
Well, I know the stress that I can recall a young guy whose wife delivered in Vellore, and this guy was stressed in the at work. I think he was made to sit on the bench or something, as they would say in the software industry. So he was stressed, and just then he had a baby, and he had to keep traveling between Vellore and Chennai, and he had no other risk factors, and he was a teetotaler. In him, at least, we thought, I thought that stress was the primary thing because he was too preoccupied. Now that his family had become bigger, he has become more responsible, but he was just about to lose his financial stability. So that was one part of it. And he did have a stroke, but luckily, young brains survived better and he did make it well. He came in time and we could do really well. So that was an instance, but there is many other instances that we can keep talking about. So stress, yes, we have had specific instances where people have ignored symptoms and gone on and had massive strokes, and they ignore the warning minor things that happen, and ultimately land up with a massive stroke and have done badly also. So very important to recognize stress as and when it crops its head up. So very important to take care of that.
Doctor, I have a question coming in from Luke. He's asking that you mentioned about two different kinds of stroke, ischemic stroke and hemorrhagic stroke. Could you explain the difference between the two? And he's asking, are we susceptible to one over the other?
We are the risk factors basically are hypertension is the same for both. If you have hypertension, you have risk for both. If you're a diabetic, you're more likely to have an ischemic stroke rather than a hemorrhagic stroke. Doesn't mean you won't get it. Diabetes doesn't protect against it. The chances of an ischemic stroke are higher than the chances of a hemorrhagic stroke. So similarly, if you're an alcoholic, if you're consuming alcohol above permissible levels, now we have evidence. Actually, I must add here that no amount of alcohol is safe. We now have evidence that we say that there is safe amounts that people can consume. There's nothing like that. No amount of alcohol consumption is considered safe today. That's becoming increasingly evident from scientific studies. But still, if someone consumes a lot of alcohol, you are more likely to have had a hemorrhagic stroke. So it's important. So what is the difference between the two? Well, the name says ischemia means lack of blood flow to a region, and that is so there is a block. The blood flows through the artery, and if the artery gets blocked, the region that is supplied by the artery and the nerve cells start dying. So ultimately, the blood carries hemoglobin, which carries the oxygen to the cells that in the brain. And if this doesn't reach the cells, well, they can't metabolize, they lose their viability and they die. Now, that is why ischemic stroke, the cells are destroyed. Now, imagine you having a hose in your hand in your garden and the hose is blocked, what would happen to your roses that are supposed to be watered? They don't get the water, they die. But that's a chronic thing. Here, it occurs acutely. The brain can't withstand a lack of blood supply for more than a few minutes. So the nerve cells can start having problems. So that is ischemic. Well, what happens in hemorrhagic stroke is that the arteries, the major arteries, and then there are smaller branches, like how the river has tributaries, and from there the streams come and everything else happens, channels come. That's how they reaches smaller areas of the brain, like any other organ. So if one of those small blood vessels then rupture because of the high blood pressure, because of problems in the bleeding tendency in a person, then that bleed can go directly into the brain. And if there is bleeding into the brain, again that's going to affect that area of the brain, and that blood is going to cause problems. So that's the difference between ischemic stroke and hemorrhagic
So, what happens when a person gets a stroke? For example, I mean, I know it may sound like a very layman question, but if someone around us is having a stroke, is there a way to understand that the person is having a hemorrhagic stroke, and how can we help? What should we do then?
stroke. Right. So that's the campaign that we run all the time about identifying the early signs of a stroke. Very important. In fact, we have even produced a short film called Turidam. You go on YouTube; it's available for free. It's a short film itself, done by actors who are all who have acted, and we've done it with a director called Subbu. And so there, it's about a story. It's a storyline and everything. You'll understand. So the point is that Turidam was the Tamil equivalent of what we call fast. Initially, we used to say fast. Now we call it Be Fast. So Be Fast is B is an acronym. It's an abbreviation. So it's a B. B is for balance issues. You see someone suddenly walking unsteadily, unless he's drunk and has other reasons to be unsteady, then sudden onset balance issues. So they start having a severe spinning feeling. They start staggering this way, that way. That's for B. E is for the eyes. Then suddenly the eyes go to one side, or they say double, or they can't see one side. They say there's one half I can't see, or one eye the vision is gone. Suddenly become blurred. Those are eye signs. That's why E. F is for facial lag. Their face goes to one side like that. There are muscles on both sides of your face. So if you want to say E, know that these are acting equally. Now, if one doesn't work, supposing this doesn't work, what will happen? That when you say E, it's going to go like that. That's the facial deviation, right? Because this side is not working, this side is normal, so it pulls to that side. So it means that the weakness is on the other side. So that's facial. And then you ask the person to lift their hand. And if they can't hold their hand like that, the hand starts dropping. That's for the arm. So that's F.A. S is speech. If they start slurring suddenly, they speak and then they say, or they can just can't even talk. They don't understand suddenly what you say. So that is for S. Last is T, to stress that time is everything from then on. So this is called B fast. Balance issues, eye issues, facial lag, arm drifting, speech impairment. Then time is brain. That's what T is for. Why we say time is brain? After that stroke or the ischemia happens, the blood supply is blocked. Every minute that you delayed treatment, 19 lakh cells die in the brain. That's the estimate. So you can imagine 1.9 million or 19 lakhs. So the brain has billions of neurons, but then what is lost is lost. You are going to have some residual problem. So that's why T is for brain. So this is something is in the Tamil. I don't know if you understand Tamil, but this I translated into Tamil and said that Miga Turidam. You know, Miga Turidam. We initially called it Turidam. That's the name of the movie. Now we say Miga Turidam. Migathuridam is like midakam unarvu. You like balance issues. Then Ka is for kan parvai problems. Tu is for tuvalum kai, with the arm here. Re is for sariyum Y. One side it lags down. So sariyum Y. Ta is tadumarum pechu. Im is neram avasaram. So we said the same thing in Tamil. We wrote this acronym, which actually I wrote down. It's called Turidam or Migathuridam. So that's the same thing for somebody who wants to know in Tamil. Be fast. That's in short, nutshell, how you can identify a stroke. So if you are at a mall, you are out shopping, and you see someone developing any one of this, then please remember that the first thing you can do is not do a cardiac massage, not do anything else. Call the ambulance and get the first call the ambulance, then stabilize the patient. So the time that the ambulance takes to come, and then shift to the patient to a place where a scan is available. Now I'll continue this and say that we were talking about heart attack and the brain attack or the stroke. What's the difference? A heart attack or myocardial infarction can be diagnosed with an ECG. We have seen that there are two different types of stroke. Now, unless you do a scan, you won't know what type of stroke you have. If there is a blood supply block, you need to give drugs that will bust the clot. If you bust a clot, you don't want the blood to clot. If you do that in hemorrhagic stroke, it can be catastrophic. Already bleeding is happening. So we need to first know whether there is a bleeding at all. So rule out a bleeding is the first point, and then which artery is blocked. The major arteries, we can go in and even remove the clot. We can give clot busters now within 4.5 hours. We can go in and remove clot from at least the major arteries. We can go in and what's called thrombectomy. Thrombus means clot, ectomy means removal. So we can remove the clot if within 16 to 24 hours even. So there are many methods that we can do, but we should remember that the time loss. Suppose they come after 24 hours, nothing can be done. And that's not uncommon, I would say. If somebody starts developing a speech impairment, so the wife says, you've been working through the day, you're very tired, okay, drink this or drink some milk and go to sleep, you'll be all right in the morning. By then, every opportunity is gone when he wakes up. He has a completed stroke. And after that, it's only like physiotherapy and taking care of him and then bringing around with rehab. He can still do rehab, but you lost that opportunity for something miraculous that could have been done. That's very important as well.
So you're saying the time is very crucial, that you recognize that somebody has a stroke and rush them to a hospital. And the window you would say is 15 to 20 hours, like from the conversation, that's what I understood.
4.5 hours is the time window for the clot busting drugs. We call them the thrombolytic drugs that is given injected into your veins. And if you have a major artery block, then the clot removal can be done, thrombectomies can be done, but they can be done up to 16-24 hours. But remember that the first point, that even within this 4.5 hours, every minute 19 lakh cells are dying. So it doesn't mean that you have time till 4.5 hours. Till 4.5 hours is when the drug has been shown to work. But the earlier you bring in, every minute you save, bringing the patient to the hospital matters. And every minute you're going to be losing about 19 lakh cells. So the earliest would be the first thing to remember.
Doctor, one more thing. Maybe sometimes people don't rush, their family or friends to a specialty hospital or to a hospital with a lot of multi-specialties. They may, like, I have a close friend who passed away in Chennai last year. He was rushed to a small clinic because he had chest pain, and they gave him medicine for gas, and he passed away within a few hours. Is it also important for, like, for example, you don't know whether, if someone is slurry, or they're like you said, they have speech issues or they have eye issues, coordination issues, whether you should take them to neuro or cardio? How do you make those decisions, or you just take them to a multi-specialty hospital?
Take them to a hospital with a scan. That's the first thing to do. So you save time. hospitals that have a scan saves a lot of time, because what happens in such hospitals, like our protocol would be, the patient comes into the emergency, is wheeled to the scan, you're ready to thrombolize or give the clot busting drug, even in the scan room if necessary. Now, this saves a lot of time. So it's very important to go to a stroke ready hospital. What does stroke ready mean? That you're ready to handle stroke. That's what it means that, so you need to take them to a hospital that has a scan. You can't go to a scan center, then shift the patient to the hospital. You can imagine the amount of time that might be wasted.
What happens after the person has a stroke? We did discuss what happens to the body, but let's say that they are rushed to the hospital within your 4 hours or 15 hours window, and you have given all the medicines and all the procedures are done. Can they come back to their normal lives, or does rehab take a long time? What happens when a person has gets stroke?
If a patient is uh, he comes to the hospital within the window period and is thrombolized, or he undergoes a thrombectomy, then his chances of getting back to a normal life are higher. Higher. It can never be 100%. Nothing in medicine is dogmatic. It still depends on what damage has happened before you've done the procedure, before the medicine has been given, how much damage has happened, and there is always that variable. Every brain has a little different way of withstanding insults, like ischemia or bleeding. So some brains can withstand better and they can bounce back better. Leaving that apart, so what happens? Well, if the brain is already affected, and then what will happen if you have an ischemia, like if you tie a little string or a rubber band around your finger, what will happen after some time? It starts swelling. Well, you cut off the blood supply, it starts swelling. So the brain can start swelling, and that's an important complication during the initial days of a stroke. That's why the acute phase of a stroke, the patient is observed in an intensive care unit. And once past that phase, then rehab starts. So once they stabilize and rehab starts, rehab is started in the ICU itself. Rehab is started, somebody starts working on the muscles. If somebody has a hemiplegia, meaning that one side doesn't work, then the whole thing is started then and there. They start physio there, but that has to be continued. Now, if somebody has speech impairment, a speech therapy would be important. But then a proper speech assessment before we decide on what type of speech therapy would benefit the patient. Somebody has needs support, then psychological therapy would be important. An occupational therapist would come into role. It's a multidisciplinary thing after that. Very important.
I have a question about something which happened to another friend. I mean, you must be wondering, I have too many friends who have either got cardiac arrest or heart attack, but sadly, last year was a period like that. Another friend had a cardiac arrest. He got some sort of CPR intervention before he was taken to the hospital, and he has lost ability to speak for speech, movement, a lot of things. And the rehab is taking a long time, and we don't even know how much the rehab is going to help. So is rehab after stroke also as difficult as after a cardiac arrest?
See, the heart pumps the blood supply to every organ in the body. Now, if there is a lack of blood supply, means a lack of oxygen to the brain, then if there is a delay. Now, if you imagine that you're standing and you see people fainting in a children fainting in a prayer meeting, people fainting, standing in the queue for a long time. Then what happens there? What is fainting per se? The BP drops. Means the pressure at which the blood is supplied to the brain falls. The brain doesn't work. You fall down. That's what happens. It's called a syncope, and that's how a fainting attack occurs. Means that the brain is very sensitive, so it cannot withstand uh, slightly longer periods of ischemia. Even if the blood pressure is gone, the blood flow doesn't happen. Anything beyond 2 minutes, then the brain starts having problems. Very transient, it can manage. It can just fall down, and the minute they fall down, and the minute the blood supply is resumed, because they've fallen down and they get up immediately. but that's not the case always. Anything more than 5 minutes, then you will have permanent damage. So, what in your friend's case, unfortunately, would have happened is that the damage, the cardiac arrest, and the cutoff of the blood supply to the brain would have lasted longer. And it also depends on how the basic brain was. It was a very healthy brain having an issue, and a brain that probably has subclinical issues which nobody keeps testing. Well, I don't go and test I do an angiogram and see how my blood supply to the brain is. Unless there is a need, nobody does it. Nobody has to. There's no indication. So if already you have some problem that is subclinical, means that it is not seen outside, you probably have more problems. So there will be multiple factors involved in it. So basically, if somebody is not recovering well, it indicates that the damage that happened at the time of the cardiac arrest to the brain, the number of cells that died, the number of cells that were irreversibly damaged was high. If somebody recovers quickly, means that irreversible damage was minor. What happened was a reversible damage. The brain had withstood the onslaught pretty well.
And this applies to stroke as well. What would the rehab time be once a person has a stroke?
Yes, so it depends on the core. If there is a core of the region that is affected, how many cells have died? There are a lot of cells have died. Then the brain has to be stimulated with physiotherapy, with everything else, so that the brain starts working. It's called plasticity. Some other cells taking over, new cells forming and coming in. It is going to take time, and you need to stimulate the brain with physiotherapy and other forms of work, so that the brain tries to take over. One part of the brain takes over the functions of the other part of the brain too. Something like that happens. I'm trying to make it simple, sound simple. I'm avoiding complicated terminology, but that's how it starts working. So if it is very severe, well, it's going to take a long time, and you probably may not have 100% recovery. But there will always be some remnant. If you have lost sensation on one side of the body, there's nothing like the original. You will probably have a mild difference between the two, but we are more concerned about getting the person functionally active. That's the most important thing, to get back to what they were doing before and to get back to their own lifestyle. If that happens, we are more than happy. It's not like 100% is probably never possible. Always be a little remnant in many, many, many cases. But this is also what decides, yes, the damage, the extent of the damage at that point of time will decide the chances of recovery.
So, doctor, we have been speaking for 45 minutes. There's 15 minutes left, and it has been pretty stressful even listening to how you get a stroke and what happens after a stroke. So, is there anything positive that you can remember in recent times, or are people more educated? Are people more bothered about their health? Something positive and nice that you can tell us.
No, nowadays Dr. Google is keeping everyone informed. So there are many people who do know about stroke. See, the point is, there are many people. The thrombolysis started in, I think, 94, 95, 96, and we probably thrombolized the first patient in 99 or 2000 in Chennai. So in 23 years, there are now it was such a difficult concept to even sell at that time. We had to go the heart attack way and talk to people. Now people are more aware. Good, their knowledge is in their hands, and some of them do know. And some of them know that something can be done, and do bring in the patient and tell us to. So shouldn't it be faster? Shouldn't it be done quicker? That's very nice. That's how awareness should be. So there is definitely an increase in awareness. We used to have so much difficulty in getting patients within the time window. This is not still very high. I can tell you that this is not still very high even in the so-called developed countries, where they have separate highways for separate lanes for ambulance and all that. Still, they are not that high. The percentage of people reaching a hospital within the window period after a stroke. So that's something that is definitely but improving in India. So in fact, as we see that, you can see the number of people running in the morning. See the number of people on the roads. It would be scary 20 years ago to go out on the road in the morning if you find no one. My wife would never venture out for a walk those days. Now she's able to go. Everyone, everywhere, walking around. Walking has become such a habit, and I hope it becomes a movement where everyone does some form of activity. I hope every office, every workplace starts having 10-minute breaks where everyone is told to do a little Zumba or should be asked to do some activity. You see, I used to love those things that happen in restaurants. Suddenly, these guys break into a wonderful dance and song. Suddenly, I think that should happen in a hospital, in an office too. I hope that becomes a movement. People start exercising, doing something that they love, and that's happening. So there are a lot of good things happening. There are a lot of good things happening, and when good happens, bad can't be far away. So there are improvements. There are things that we can avoid. But what is life? We don't. Everyone doesn't want to be a saint. I don't want to be. Well, I don't want to be eating fruits all the time. Be so strict and not drink water. I can't be thinking only about that. There are many other things in life. So it is important to have a balanced thing. So workouts, I think, is walking, jogging, cycling, some form of exercise, aerobic plus strength plus balance would be really good, and that's happening. Fortunately, I see it happening a lot nowadays. So it's very very good to see that.
Okay, so that's at least something positive. People are more knowledgeable about stroke. They are rushing
Yes.
patients faster to hospitals. Um, Something which someone asked me yesterday when I had shared the poster on my Instagram handle was that will a specific diet help people have lesser chances of stroke? For example, the person who asked me said, "Can a plant-based diet help?"
Well, scientific evidence says that the Mediterranean diet is known to prevent strokes and cardiac attacks. The Mediterranean diet is rich in nuts, rich in proteins, avoids carbohydrates. So what they have is a good portion of nuts and fish predominantly, non-vegetarians. Vegetarian can replace it with soy or something, and they say red wine in their diet, which can be replaced with something else. So that diet has been shown to reduce the chances of cardiac and the myocardial infarction and strokes. Apart from that, many other diets have failed to really create an impact. There are many facts, many types of diet. You just have to type diet, types of diet, and you'll probably be flooded with a lot of options. The Mediterranean diet has been shown to prevent strokes. So it's something that is approved. That is probably something that can be suggested to people who are willing to have that diet. But I believe that if you take a balanced diet, if you were to have an adequate amount of protein, adequate amount of carbohydrate and fat, carbohydrate, protein, they all depend upon how you will need energy. Fat is stored, so it can be used for a longer time. Carbohydrates are quickly used, so if you're a runner, very keen on running, you'll need a carbohydrate diet. Fat can't help you; it will only store. It's only a store. So it's similar thing. So based on your demand, you can do. But please remember that you need adequate proportions of each. It's not something that I'll take only proteins, I'll take only that. That's not the way. That's at least for now we don't have scientific evidence to support some of the diets that go that way. So it's
But you
important.
see people coming in having done fad diets, and you believe that that could have actually not been good for their body. Like people are doing these diets without understanding their bodies.
We what if we go by pure science, we know that they still do not have evidence that they work. So what doesn't work, that's the point in doing that. Does it harm them? Well, we'll have to see. There have been some studies which have shown that you have a higher cholesterol in some people who take high fatty diets and all that. But the jury is still out. The point is taking a balanced diet, exercising well, sleep well. Sleep is a very important component. You know why sleep is important? At least two, many, many, many reasons, and at least two. Night, the brain has a washout system that takes away toxins. Again, I'm trying to sound simple, avoiding things. So there's some lymphatics and other things. that happen in the brain, that works well at night. So if you don't sleep well, your brain is probably going to be clogged. It's not going to work well. Number two, this rapid eye movement sleep, the REM sleep, and everyone has eyes moving all around. That's this time when you get dreams. So imagine dreams as something that you're going through a video file in fast mode, and you get all jumbled images. That's what happens in a dream. It's very rare to have a dream that's very coherent and all that. Most times you have normal things at abnormal places, you're in abnormal areas. There's a mix of many other things in your memory. So what happens during that time? Your memory is stored, it's consolidated. So that's why students, when they go for the exams, they have more dreams. What they've read is consolidated from a recent memory to a remote memory, meaning a very stable memory, and that's what they can recall later. So your brain stores the things very well at that time. Important if you want to have a REM sleep. REM sleep can only come at the end of what we call non-REM sleep, which is three stages, then REM sleep, then again the cycle repeats. So you need to have a good sleep to have an REM sleep. So at least for these two things, now we know that if we don't sleep well, hypertension, your sugars can go up, your cholesterol can go up, all the risk factors that we talked about can happen. Important to have a good sleep. So eating well, exercising well, sleeping well are all good ways to prevent so many other things.
So we'll soon start wrapping up, Doctor. There's one question which has come in from Gauri. It is something which we have addressed, but I think this is the biggest doubt amongst the young professional people is that work from home and sedentary lifestyles. Is that a problem? How do we address it?
Work from home would be a problem if you're sedentary. So if you can keep yourself active, it doesn't. It's the same. You're sitting before the system, using the system. You need to probably have the right posture. We're not talking about stroke here. Many other myofascial, neuromuscular problems can come in, and we see that very, very often now. And so, work from home does not mean that you lie down on your cot and do your work. You do it properly, get up and exercise, and keep yourself like you go to work, and you exercise in between. You get up and walk around, stretch, do little exercises. Now, for people who have no time, as they say, there's nobody that has no time. There's nobody in the world that can say they have no time. Uh, I say this. I'm very proud to say this too. The chief minister of the state of Tamil Nadu. I don't think people can become busier than a chief minister. I'm just being honest here. He does walking for at least 40 minutes a day. I'm just saying that if you want to create time, you can create time for that, as long as you have the motivation to do that. So it's very important time. If you don't have time at all, then there can always be, instead of doing 30 minutes at a stretch, you can still do 10 minutes 3 times a day. And that can add up. That's what studies have shown. That if you can increase the walking inside, doing that, increase your steps in whatever way, can still be good. So even in short bouts of exercise can be helpful. Doesn't have to be 30, 40 minutes at a stretch. Please remember that and try to get it done. So if you do that, work from home can't be very different.
So nobody is busier than a chief minister, and a chief minister can take 40 minutes out to walk every day. Then you should. I mean, that's something I should remember again and again. Doctor, any final words? A lot of questions have come about diabetes also, on the importance of controlling diabetes. How do you recognize your diabetes, etc. But any words that you want to say while you wrap up this show?
Well, I would probably reiterate that that time is brain in stroke. So one, we look at it broadly, simple take-home messages. Try to prevent stroke. Try to control those risk factors. Of course, age can't. You can see the graying in my head. Nobody can run away from aging. So aging is something that's not modifiable. You can't modify that part of it. But time, it's important to control the other risk factors. Keep yourself fit. We have said how. We have said what to be eaten. So it is very important to sleep and all that. If you have any of the other comorbidities, as we call diabetes or hypertension or problems with cholesterol, then please have them checked and keep them in control on a scientific basis. And if you've had a stroke, please don't waste time. Every second counts, every minute, every second counts. So please rush to a stroke ready, meaning a hospital with a scan to get things done quickly. And even after that, if you've not done that, if you missed the bus, I can tell you that there is still something that can be done. Like somebody, that those old movies where they'll show people with one hand flexed and severe stroke and all that. Even those people can be salvaged. No, there are injections like botulinum toxin that can be given for spastic limbs, and physiotherapy and the multidisciplinary approach can still work. So please remember these four things. At any point of time, help is always available. There is always a chance to better the quality of life from what it is for the sufferer. That's the optimistic note with which I would like to finish this.
So let's end this whole discussion with an optimistic note that there is medical help available. There is a plethora of knowledge out there. Read more about stroke, about risk factors, understand how to mitigate it. And we have been talking for 1 hour. And remember what the doctor told us: sitting is the new smoking. So if you have been sitting and watching this live for 1 hour, like I have been sitting and doing this live for 1 hour, this is the
Both of
cue
us.
to now
Both.
stand up and walk. Thank you very much, Dr. Meenakshisundaram. That was a really helpful talk. And I would suggest that people go watch the movie which he was talking about, the short film which is there on YouTube, etc. And he gave us the acronym Be Fast. So go watch the movie; you will understand what it is. Thank you very much again, Doctor, for joining us here at the News Minute.
Thank you very much. Thank you very much for the very interesting questions. Thank you
Thank you.
very much for this one. Very much. Thank you.